Okay, today we will cover abnormal curvatures of the spine and lifespan changes. Here to the right you'll see the spine and the region where we have the 7 cervical vertebrae. Before I say that, let me make sure that I talk about the curves of the spine, or the normal curves of the spine at birth, from head all the way down to the sacrum. There are convex curves that are towards the dorsal side, and those are, and after the child stands, those curves still persist or are still able to be seen, and those persist only in 2 regions, and those are the thoracic region as well as the sacral region. So that's where we'll have our primary curves. We also have secondary curves. Let me see, can I grab a pen real quick and highlight those for you first. So we said we have curvature in the thoracic region, and then we said we also have it in the sacral region. My pen did not work. And grab that pen again. And in the sacral region. So these are referred to as our primary curves. We also have secondary curves in the cervical region and also the lumbar region. The curves that we'll see in the cervical region are due to the fact that the child is starting to straighten his head. And then the curve that we'll see in the lumbar region are due to the fact that from the child actually trying to balance when he's learning to walk. And so those are our 4 normal curvatures that you'll actually see in the spine. Okay. See if I can get the rest of this up here. Alright, so we said we had 7 cervical vertebrae. We have 12 thoracic vertebrae, and then we have 5 of the lumbar vertebrae. If we look at the sacrum and the coccyx, we know that there are fused vertebrae in those regions. So we have 5 fused vertebrae in the sacral region and 4 fused in the coccyx region. Alright, so what are some of the functions of the spine as far as protection? There's spinal cord protection. As far as attachments, we're talking about they serve as a place for the muscles to attach to the spine, and then the movements such as flexion, extension, and then also lateral flexion. And then we also have, if my pen is still working, the curves. And the curves basically provide shock absorbing capabilities to the spine. Okay, so let's start with the abnormal curvatures. We want to begin with scoliosis. Scoliosis, let me see, can I get my picture up here? Is a side-to-side curvature that you'll see in the spine. Let's see, yeah, there we go. We have this lateral curvature of the spine. Scoliosis is more common condition that appears before adolescence, generally a result of damage to the supporting muscles along the spine. So again, we have what's called a lateral curvature of the spine, so this side to side curvature. Okay, let's go on to the next one. In this one, you see the abnormal curvature is occurring in the thoracic region, and it's producing what we call a hunchback or kyphosis. It is frequently seen in elderly people with osteoporosis or chronic arthritis, or those with neuromuscular diseases. Also seen in individuals with compression fractures of the thoracic vertebrae. Okay, I'm going to try to get this other picture up here, and then this is just showing you again that exaggerated curvature in the thoracic region. And finally, lordosis, which is an exaggerated curvature of the lumbar curvature. Here you can see that this is totally exaggerated, generally seen in men possibly with a beer gut, or may also be very common in women during their pregnancy because they're having to adjust to the changes in their center of gravity. It also may be secondary to traumatic injury or a degenerative process of the vertebrae. So that's the final curvature that we'll talk. As far as lifespan changes, I've given you a list here, but it said that the body's aging process begins when? Fertilization, and then it's going to continue until the time of our, some might say, untimely death. But the changes occur at differing times, and they proceed at differing rates throughout our life. So therefore we're going to have differing rates of bone deposition as well as bone reabsorption, including the nature and effectiveness of the bone remodeling process. So we have normal processes I guess an example would be if we looked at the skull, the teeth are forming from an infant to an adult. We know that the fontanelles are going to close and sutures are going to form. The skull will also expand to accommodate the larger brain. So that's normal bone deposition and reabsorption in order for those things to take place. Degenerative aging processes affect the spongy bone. The spongy bone we know will weaken before the compact bone. This generally happens between the ages of 30 to 40. In many cases, we know that problems arise because of abnormalities in bone remodeling that result in a decrease in the osteoblast activity, and having an increase or a gradual increase in the osteoclast activity. When the osteoclasts outnumber our osteoblasts, we know that we're breaking down more bone and releasing more calcium into the bloodstream, and depositing less calcium and phosphate into the bone. So the bones are definitely becoming weaker. Furthermore, we know in compact bone, older osteocytes, they tend to shrink, we know, and this results in the appearance of a tiny honeycomb-like open, and the result is that the bone is thinner. We said the bone has lost more of its density. So the skeleton as a whole will do what? It's going to lose its strength, and bones are going to become brittle and have a higher risk for fractures. So we know that hip fractures are more common because hips are the weight-bearing entity of the body. So again, these are weight-bearing bones. So they're carrying most of the weight of the body is carried in the hips. So we know that the hip fractures are going to be pretty common because of the fact that that they're carrying the weight. Also, it is the loss of, let's look at the trabeculae in spongy bone. The loss of the trabeculae. Remember, trabeculae are the functional unit of spongy bone, and the resulting compression fractures in spongy bone of vertebrae that cause what? The progressive decrease in height that we talked about. So this decrease in height around the age of 35, that is typical consequence of aging. It is true that all of us, what are we doing? We shrink with age. And the process begins earlier than we might think. Again, we said somewhere around 30 to 35. So, if you've done your osteoporosis case studies, for example, we know that there's some things that we could do to help minimize the effects of aging. And so what do we want to do? We want to do regular weight-bearing exercises. And not only do we want to do that, but we want to couple that with what? Good nutrition. So we want to do weight-bearing exercises. And then we also want to couple that with what? Good nutrition. And we want to make sure that we're also taking in what? Adequate amounts of calcium and vitamin D. And if we can, because we know that one of the things as far as the level of calcium falling as we age, we know that older folk tend to not get as much sun as possible, which means that we don't have the conversion of cholecalciferol into the active form hydroxycholecalciferol, which is the active form of vitamin D. And we know that that vitamin D is very important in the absorption of calcium. So, and all of these things is going to help minimize the degenerative effects of, again, skeletal aging. If we're looking at the bone loss in being more rapid in menopausal women, remember one of the problems is that they've got this huge decrease in the amount of estrogen as the ovaries stop producing estrogen. And then this is going to increase the loss of bone, okay, or the loss of the deposition of calcium in the bones. Alright, so on this final slide, you'll see that we have a slide that shows, or two pictures. One is of normal bone, the other one is of osteoporotic bone. And you can see the osteoporotic bone is very airy or spacious. Has many gaps in it because of the shrinking osteocytes, and the bones are light and airy because we're not depositing that bony matrix like we were before. So, anywho, I hope you guys have enjoyed this presentation, and I will see you later.